Hi, this is Dr. Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. So I just wanted to take a few minutes to come on here and post a video because it is flu season, and I don't know where you are, but here in Florida, in the Tampa area, there is a virus that's going around and people are concerned, and rightly so, and I get it. But first, I would like to say we should not panic. We've been through this before, and panicking does not help anything. We should be informed and do what needs to be done to help us to get better or hopefully prevent us from getting sick. So symptoms that I am hearing from my patients or just people around me who I know who are getting this include things like fever, even though some people don't necessarily have a fever. Fatigue is a big issue. Sore throat is a problem where people are saying it feels like they have knives in their throat. I remember one of my patients, when she reached out to me, that was her description. A cough. And this cough tends not to be productive, even though they feel like something is in their chest feels congested. It's just very hard to bring up anything. Sinus pain, pressure may or may not be a part of it as well. And it's taking some people several days to get over. And so people, if they're doing like a flu test for influenza, I've had people do strep test, COVID tests, they're all coming up negative. And so again, I would say not to panic, but be informed and do things that can help boost your immune system and help to decrease inflammation and hopefully prevent you from getting sick. Or if you do become sick, it will not be as severe or as lengthy. So vitamin C is one of the things that we should always have on hand. Of course, we get it naturally here in Florida through our citrus fruits such as lemons, oranges, limes, but it's found in other food like kiwi, strawberry, even bell peppers, specifically your red and yellow bell peppers. Papaya is another one that is a good source of vitamin C. Side note, papaya is also very good if you're having GI issues, but back to what we're talking about. You can also supplement with vitamin C if needed. So when my patients are sick, usually I'm asking them to take about 1,000 milligrams of vitamin C several times a day, and to take it to bowel tolerance, meaning that once they start having loose stools or diarrhea, which is a side effect of vitamin C, they should back down on the frequency and maybe the dosage, maybe decrease it from 1,000 to 500 milligrams a few times a day. But I would encourage them to take that throughout the illness until they feel better. Vitamin C is a water-soluble vitamin, so unless you have kidney issues where your kidneys are not working properly, you can take it. Or unless you have something like G6PD deficiency, where high dose vitamin C is not a good idea, most of us can take higher doses of vitamin C. And like I said, food is medicine, so try and get it through those foods that I just discussed. Zinc is another one that's very important. It's just not an important nutrient. Zinc in itself is an antiviral. It helps to decrease replication of the virus. It helps to boost our innate and adaptive immune system. So it's something that's very important to have on board. Pumpkin seeds are a source of zinc. Eggs are a great source of zinc. Beef are also good sources of zinc, etc. You can supplement with zinc. Usually I ask patients to do about 25 to 30 milligrams about 3 times a day. Max dose is usually no more than 100 milligrams. I would not ask a patient to take high doses of zinc, such as 50 milligrams. The reason being, when we take high doses of zinc, our body is not going to absorb it, and that high dose zinc can cause some GI upset, so some nausea, vomiting, maybe some loose stool. So we want to prevent that. And acetylcysteine is something that you would have to supplement with. It's not really found in foods. It's a precursor to glutathione. Glutathione is a very important antioxidant that we need every day, but especially when we're sick. And when we're sick, it usually is depleted quickly. So with that, I usually ask patients to supplement with about 600 to 1,000 milligrams a day of NAC. Quercetin is another nutrient that's very important. It's found in things like capers, red onions, shallots, berries, whether it's strawberries, blueberries, apples with the skin on. You can also supplement with quercetin, and usually I'm asking people to do about 500 milligrams a day. Vitamin D is another big one. Unfortunately, here in Florida, most of us are vitamin D deficient, including yours truly. So I have to supplement with vitamin D, and usually pretty high doses of vitamin D. The thing is, vitamin D is activated by the sun. Most of us are not really going outside in the sun to get that vitamin D application. And then if you have more melanin, like myself, melanin actually blocks the absorption of vitamin D. So a lot of us with more melanin sometimes are vitamin D deficient. But vitamin D is not just for your bones. It's not just for your teeth. Yes, it is important for those things, but it's also important for your immune system. So it's very important to build up your vitamin D levels. I usually like to see my patients' vitamin D somewhere between 60 to 80 nanograms per ml. The thing is, with vitamin D, it takes about 3 months to actually build it up. So again, when it comes to certain things, it's more of a marathon. It's not a sprint, but it's still something to include if you're not feeling well. You can find it in your fatty fish, such as your salmon, your mackerel, your sardines. If you don't like those, cod liver oil is a good source. Cod liver oil also includes vitamin A, which is very important when we're sick. Keep in mind, vitamin A is fat soluble, just like vitamin D, so you can't overdose on it. You can't take too much. And egg yolks are another great source of vitamin D. So a supplement that I like to use and make sure that I have in my home, that if my husband or I feel sick, that we can reach for it, is Orthomune by Orthomolecular Products. It has all of those supplements that I just discussed, and usually when my patients are sick, I ask them to get this and take 2 capsules twice a day. I usually like to add additional vitamin C to it because it only has 600 milligrams. And if they're taking 2 capsules twice a day, that would be 1,200. And, I just said that I ask people to take about 1,000 milligrams several times a day. So I usually ask them to get some additional vitamin C for that. And possibly some vitamin D, especially if I know their vitamin D levels, which I check my patients' vitamin D levels routinely. So that is something that if I know they are not between 60 and 80, I ask them to add that. With this product, you cannot find this product in your local grocery store or your local pharmacy. It's important to take good quality supplements with good quality ingredients so your body's actually absorbing it. So you can get it through either a clinician like myself who has an account with Orthomolecular, or through several compounding pharmacies in the area actually carry this, and you can just go in there and purchase it yourself. Another thing that can be helpful are nasal rinses. I prefer the one that looks like this versus the neti pot because it gets a little bit deeper into the sinus cavity. So if you're having like a lot of nasal congestion, stuffy nose, post-nasal drip, persistent coughing, a lot of times this persistent coughing is being caused by this post-nasal drip. Sometimes it can be more of an irritation and inflammation of the airway. But many times it's post-nasal drip. Doing a nasal rinse at least twice a day, once in the morning, once in the afternoon, before bed, is very helpful. You must use distilled water with this. Please do not put tap water up your nose because that's going to cause some other problems. And when you purchase this, it has the saline packs that come with it. You can do 1 or 2 saline packs, but this is something that can be very helpful. Other things that I like to use, this is Cofix nasal spray. It's the iodine nasal spray. I squirt 1 squirt to each nostril 2 to 3 times a day. This is going to help to decrease any viral replication in the nasal cavity. And then this is a betadine gargle that I like to utilize, and it's the same thing. You gargle with it about 15 mLs for a few seconds, spit it out, And it's the same thought as the nasal spray is going to help to decrease viral replication. And if we can decrease viral replication, hopefully you won't be as sick for as long. The next is relative rest. So again, one of the things that people are complaining about is this makes them very tired, very sleepy. Rest. If you need to rest, rest. However, I would say do not lie in the bed all day. That is going to be a detriment to you. So get up and go outside if you can. I know it's going to be cold for us Floridians. Bundle up, but go outside. Get some fresh air. Hopefully get some vitamin D. The other thing, just sit up, maybe sit up in the kitchen, sit up, watch a movie, things like that, move around in the house. It's important for you to be taking these nice deep breaths so you don't have any issues with your lungs, and lying down is just, all day is not the best answer. So try your best to get up and move around. Sunshine, I already talked about that. Again, that's activating our vitamin D. I know we in Florida are kind of wusses when the temperature drops, so we bundle up. But in order for that sunshine to be absorbed, it needs to get on your skin. So even if you can go outside for a little bit in a tank top or a t-shirt that allows that skin contact with the sun, that would be good. Anti-inflammatory food. So food is medicine. That's very important. So incorporating things like ginger, garlic, again, berries are very good. Greek yogurt or kefir both have good probiotics in them that can be definitely helpful in boosting our immune system. Honey is a great food, a superfood if you will. It can be very soothing, especially if you're having that sore throat. Again, incorporating foods that are high in vitamin C, your oranges, your lemons will be helpful as well. Warm salt water gargles can help to decrease that sore throat. You can do that several times a day. Hydration, so making sure you're drinking fluid, specifically drinking lots of water throughout the day. Usually with my patients, I'm asking them to drink about half their body ounces in water a day, or half their weight, in ounces a day. So if you weigh 120 pounds, at least 60 ounces of water. The thing is, when we are sick, usually we're sweating, we're coughing, we're sneezing, and so we're losing fluids that way. So you ideally should be drinking more than that. And then if you are doing a lot of sneezing, a lot of coughing, a lot of sweating, if you have loose stools or diarrhea, incorporating some kind of electrolyte mix into the routine would be good. I actually recommend LMNT powder because it's not high in sugar like some of the other ones, but it has the electrolytes that we need, especially if we are having loose stools or diarrhea. We're losing a lot of potassium that way, and we can replace it that way. We can also replace it with our foods. And again, things like avoiding sugar, which I know sugar tastes really good, and especially when we are in the holidays. But sugar is pro-inflammatory. It's going to lead to inflammation. So decreasing sugar, decreasing processed foods, junk foods would actually be in your best bet. Actually doing some kind of fasting or autophagy, allowing your body to go through autophagy, which is a period of time without eating. And what autophagy is doing is removing the debris, the cellular debris from our body. That is only accomplished when we're fasting. So it may not be a bad idea to, if you're not really that hungry, to decrease, the eating time, but just make sure that you are hydrating. You do not want to get dehydrated on top of, feeling unwell with this illness. So those are just some of the things that I ask my patients to do. Those are the things that I would do. And I hope this video was helpful for you. Again, I just wanted to make it so to tell people you don't have to panic. Just take the proper precautions, use common sense, prepare. Again, a lot of times when we have these things happen, we panic. But health is not something that happens just then in an acute event. Health is something that we try and do every day, and make good choices so that if we do become sick, we can hopefully if God wills, overcome it and overcome it quickly. So again, this is Dr. Stasha-Gae Roberts, nurse practitioner and owner of Compassion Primary Care. If you do not have a primary care clinician and you're looking for one, I do offer free 15-minute virtual visits for anyone in the Tampa area who is interested in wanting to learn more about my practice. You can also go to my website, compassionprimarycare.com, to learn about what I do. Thank you again for watching. Please like, share, and follow. And it is my goal, one of my goals for 2026, to do a lot better with YouTube as far as posting videos, etc. So I will be doing that more often. Again, thank you for taking the time to view this video. Bye-bye.